Dr. Bedell, I do want to talk to you about what she had, something called a HELLP Syndrome. Can you talk to us a little about what that is? We do have a graphic that shows us a little bit of what that means.
Right. So HELLP syndrome is actually a very specific type of preeclampsia, which is a condition that only happens in pregnancy. We're honestly not exactly sure what causes it as an OB-GYN community, but her situation actually started with just some high blood pressure towards the end of pregnancy. And we just had to do some extra monitoring with labs and to see if something like this develops or if they just develop preeclampsia, which would mean you'd have to deliver the baby early.
And how can that affect the baby?
So with preeclampsia and with HELLP syndrome, there can be some emergencies if it's untreated and the treatment is to deliver the baby. So it's kind of a waiting game of not wanting to deliver the baby too early, because there can be some complications with having a premature baby as well, versus letting preeclampsia or high blood pressure progress to something worse. So
high blood pressure being one of the symptoms, correct, as well? And we have a graphic showing some of the other symptoms. I want to share that with our viewers. Headache, vomiting.
Yeah, nausea and vomiting. That's actually one trigger that it might be happening, because that's very unusual for that to happen towards the end of pregnancy. Right. Typically in the beginning of pregnancy, as everything is developing.
You have all those fun symptoms.
Yeah, nausea is very common, but towards the end. And Miriam actually called me, or you left a message at around 5 in the morning. I have a really bad stomach ache and abdominal pain, which sometimes can be confused with contractions, but in her case it was the HELLP syndrome, where you can get elevated liver enzymes and your platelets can become really low, and that's just a sign that you need to have the baby before it gets worse. And so that's why April was born at 35 weeks.
Via C-section, correct?
Yes. Well, we started with an induction. You can still have a vaginal delivery if you have preeclampsia or HELLP syndrome. And then it progressed a little worse. Her liver enzymes increased and her platelets got lower. And then April's heartbeat wasn't exactly cooperating with the medication to cause contractions. And so that's why we ended up doing a C-section.